Okay, then welcome to my talk. 1 second, how do I get rid of this Zoom? Yeah, welcome to my talk about the COVID-19 Twitter monitor, our attempt to aggregate and visualize COVID-19 related trends in social media. For newly emerging and rapidly spreading diseases, it is necessary to quickly obtain relevant information, such as the location of the outbreaks, the number of cases, the symptoms of the disease, and possible treatments or interventions. Social media platforms like Twitter are popular for making real-time information about worldwide events accessible as they unfold. Therefore, Twitter is particularly useful for providing information about emerging diseases that are locally and dynamically fluctuating, such as COVID-19. The animation displays the development of confirmed cases shown in the map and the number of tweets related to COVID-19 in the graph between January 1st and April 7 of 2020. We can see that various events during the rise of the COVID-19 pandemic led to a burst of tweets in these months. So, for example, on January 21st, the Center for Disease Control and Prevention, short CDC, confirmed that the first coronavirus case is in the US. And on February 25th, the CDC said that COVID-19 is heading toward a pandemic status. And the biggest burst, which we can see March 11, is the date on which the WHO declared COVID-19 a pandemic. So until May 8th of 2020, we already had over 620 million tweets contain the hashtag COVID-19 or coronavirus. And this hints at the enormous amount of potential information that we can obtain from Twitter and then utilize to fight against the COVID-19 pandemic. Therefore, our aim was to create a platform that provides insights into the development and the spread of the COVID-19 disease through information automatically obtained from Twitter with the help of various NLP methods. To analyze and to extract information about the pandemic, we developed an interactive web platform and called it COVID-19 Twitter Monitor, which you can see on the left. In the case of emerging diseases, such as COVID-19, we face various problems. One of the main problems is that we cannot expect to find disease-specific data set. And for this, we apply methods for our interactive visualization that are condition independent, so that you can expect the model to generalize well to unseen and newly emerging diseases. With the COVID-19 Twitter monitor, we aim to provide a platform that can not only be used by domain experts, but then also by a broader public. So I show you now the processing pipeline, and we can divide it into different stages. So first, we have a data retrieval stage. Here we download and then randomly downsample tweets from the COVID-19 Twitter dataset of the Panacea lab. The dataset is gathered via keyword search in the Twitter stream with keywords related to COVID-19. As of June 2021, the dataset contains more than 1 billion tweets in over 53 different languages. And then in the second step, we apply, before our data acquisition, before our knowledge acquisition, domain-specific preprocessing. And after that, we enrich the database with the results and the acquired information so that we then can show in the last step the obtained information with the interactive web interface. The information is acquired with methods of 3 different levels. On the span level, we detect spans that are URLs linking to preprint papers and spans of truck brand names by applying entity recognizer. On the single post level, we use our binary classification regarding the personal health mentions, utilizing a BERT transformer model. And we also apply an ensemble of sentiment analysis systems, which are partly pre-trained and partly rule-based. And the methods we use on the corpus level are mainly to construct different distributions, like the distribution of hashtags or the language or truck brand names. But we also apply our LDA topic model, a probabilistic and unsupervised model, which is able to discover distinct topics in the underlying tweet corpus. And next, I will show you exemplarily one method from each of the three different levels. So now I will present a method on the span level to find and to cluster URLs linking to preprint papers. Here we first get the URLs within a tweet by using regex, and then to unshorten short URLs, we recursively request the destination of the link. In the second step, we then extract the domain and the top level domain so that we can then, in the third step, compare them against a manually created list of 55 servers for preprint papers. And then additionally, as a method on the corpus level, we have in the fourth step, the measurement of the string similarity of the URLs to the cluster URLs in the cluster to find links that link to the same preprint paper, which then serves us as an indicator of the popularity of a paper. So now we come to a corpus level method, which allows us to create a truck brand name distribution. Here we identify truck brand names within a tweet and gather the normalized terms to create a corpus level distribution. For this, we apply Ontogene's biomedical entity recognizer, short Augur. Augur is tailored for biomedical entity recognition and uses a combination of dictionary-based lookup and flexible matching. We can access the terminologies over the dictionary lookup via the bioterm hub, which you can see on the right. The bioterm hub provides a collection of biomedical terminologies, for example, terminologies of genes or terminologies of proteins, cells, or chemical entities. And here we use the RX norm terminology, which is a US-specific terminology that provides normalized names for all clinical drugs available in the US market. But we only consider entries with the term types corresponding to brand names, since this allows us to significantly reduce the number of mismatches with a minor reduction of the overall matches. The method we use to identify personal health mentions is dealing with the classification of a single post. In the task of personal health mention identification, we want to identify tweets which are concerned with personal health of the author of the tweet or a person familiar to the author. Here we use a BERT model with a sequence classification head. The model was developed by Tilia Ellendorff for the personal health mention identification subtask of the social media mining for health shared task in 2019 and obtained the best results. The system was trained on two different datasets, the Twitter vaccination dataset and the Twitter infection dataset. For each dataset, it is trained with a 10-fold cross-validation setup, which are where all parameters of the resulting system were merged across the folds. And in a second step, the parameters of these two resulting systems were again merged into a single system by giving 9 times the weight to the model trained on the infection data. And to do this separate training on two different health contexts, this model is able to generalize pretty well to unseen conditions. So now I will show you the actual platform. And for a clear overview, we visualize the results in 5 tabs. In the Data Statistic tab, for general distributions, the Topic Model tab to display the LDA topic model, and the Dataset tab, which allows us to retrieve tweet IDs of the currently used dataset. And now I will present the Detection tab and the Twitter Scanner tab in more detail. So here we can see the Detection tab open. And now we can access the sentiment analysis by a given hashtag. And you can see the sentiment of each hashtag over time. And on the right, we have the truck brand name distribution, which is obtained by the application of OGA. And on the bottom, we have the list of preprint papers we could found in the downsampled dataset, and then also the number of tweets we could found with this preprint paper link. So now you can see the tweet scanner tab open. And on the left, we have different filters we can apply. For example, we can select for the language, or we can specify the date range. And then we also can select different detection types, for example, the sentiment or the truck brand names. And then also preprint papers, which then only shows us tweets with these kind like preprint papers or not brand names. So here we now selected a number of samples we want to display, and on top we can also select the hashtags we want to have inside the tweets. So to conclude, I presented an interactive web platform that aggregates and visualizes the different methods for social media mining regarding COVID-19, which reveals underlying connections in the data. And additionally, we apply only condition-independent methods that exist of either unsupervised or pre-trained models that can be expected to generalize well to newly emerging diseases. Our web platform targets a specialist audience as well as a general public. And then in the future, we will add additional analysis methods and apply the methods directly to the Twitter stream to make a real-time analysis. So thank you very much for your attention, and I guess I could now open the presentation for questions.
Okay, thank you very much indeed. I ask all to ask their questions, can be on the chat, or if somebody may give a sign or just open the microphone on speaking. I start with a question. The first logical question is, and who is the target for this website? You said for the big public, but who especially should use this monitor or could use it?
Oh yeah, so thanks for the question. And yeah, like we said, or like what our goal is to have both like people who try to find specific information, for example, when you search for the personal health mention, and you're interested of the development in the disease and people who experienced already the disease, then you can find tweets and people reporting about their personal experience. And and also maybe more people from the medical domain, which are interested in the different drugs people use to deal with COVID-19 pandemic, or also misinformation about the drugs, right? So for people who concerned about misinformation spreading on Twitter about COVID-19, so that we then can tackle this kind of misinformation. Yeah, so I think so the potential audience can be both people who have a very certain interest and people who just want to inform themselves about the spread and about different data points, for example, hashtags that are used around the pandemic, lockdown, for example, where you can see the lockdown hashtag that occurs on a specific time point and then has this peak and then flattens again, and other hashtags that occur, and you can see always the specific time point when these kind of topics occur inside the Twitter stream.
Thank you. Is there any question at the moment? If you have, just open your mic and speak.
Yeah, I have basically two questions. Maybe I start with the first one. Have you found a way to localize the topics to a certain country like Switzerland? I'm sorry for background noise. I had to move outside because of all the tracks that are parallel. So is it possible to say I'm interested in what's happening, particularly in Switzerland on COVID-19?
Yeah, so to this point, we don't have this kind of localization. And one of the problems with localization is that Twitter now tries, so sometimes it's still possible to collect the location of the tweets, but in the beginning of Twitter, it was possible for every tweet. So I think then that's what people did in the research community, often try to localize the tweets, but now I think by default it's prevented to have the location of the tweet. And then, of course, we can find them over also a kind of a keyword search, locations mentioned in the tweet. But just due to the amount of different methods we apply, we had to filter out methods that seem to us more relevant and less relevant. Or also because we actually knew another group were working on the localization of tweets.
Okay, and my second question, now you have provided this platform, which is cool because it's a cool tool to interact with it. Are you aware of any real world use cases where people have really applied it, used it, and found some insights that were not available before?
No, not so far, but I mean, it's of course first it's difficult to just kind of get the platform to the public to get it known, and then on the other hand, I think also from a research interest, we wanted to show that these kind of especially unsupervised and pre-trained models that you can apply for emerging diseases are possible to gather the information and also to have this kind of platform at a first step. And I guess now we can elaborate on it, go deeper into the methods and trying also different methods for real-time coverage. And then maybe it will also attract more people to actually use the platform. Yeah. But we are happy if you want to use it, to test it, also about critic and if you have potentially methods you want to apply us to the tweets, we are also very thankful to know all this.
Okay, thank you.
Okay, there's just driving a question from Niklas Bodenmann. Thank you for the presentation. How do you handle the topping modeling? Are the models continually trained with only the latest tweets? Are all the tweets since the beginning aggregated, or is something else going on?
So for now, one of the main problems we have is to display more than, for example, 1 million tweets, right? So just to because some of the methods we apply use actually the tweets to then while you display it to analyze them, and others are trained on the whole corpus. And for the topic model, we use the tweets we download, and then we apply with every update the topic model on all the tweets we basically have now in our database. So I hope that's clear.
Thank you. I've seen just before Fabio held up his hand. Did you something to have you something to say? Thank you.
I was a quick follow up on Mark's question. I'm sorry that I cannot switch on my camera because I'm on a device without laptop without a camera now. But I wanted just to say that we have some ongoing discussions with potential users. There is a research group based partially in Switzerland and the US who would like to use the tweets and collection of tweets to do some sociological studies on the impact of COVID-19, and this goes also a bit to answer the question about localization. It's true that so in the past geolocalization was enabled, but by now a user has explicitly to opt in to keep tweets geolocalized. So there is a small percentage of tweets which are geolocalized, but still over millions and millions, you might still find enough tweets which are geolocalized, and you might be able to derive interesting insights from this small amount. So this is something we want to explore.
Yeah. I mean, localization is not only about the geolocation, but it's also about, say, people who are writing or topics they are dealing with. If they mention, say, typical Swiss locations like the Matterhorn or whatever.
Yes, we were thought of that, of course, but
yeah.
that's very, very, very dodgy. I mean, you cannot be sure. So this can be tried, but it cannot give you a certain localization of people.
Yeah, and I would say the other problem with this kind of localization is that to the enormous amount of bots we have now, that they use, for example, news bots that update news about COVID-19 and then have a lot of countries just listed to make themselves more seen and more aware. And this kind of noise is a big problem to filter out if you don't have the actual geolocation of the tweet and you just want to retrieve the location over locations that are mentioned inside the tweet itself.
Okay, thanks.
Okay, I have one question myself. What do you do about errors or false messages in the tweets?
False message in which sense?
Like
information or?
Wrong information. I suppose not every tweet is true. I don't even speak about fake messages. There are sometimes easier to find, but let's say there are errors in it, in this in the content of these messages. Do you find this out? This is a name to do this, or?
Yeah, thank you for your question. So actually, we are planning now a second research project exactly about disinformation and misinformation inside the tweets. And also, this will concern also the amount of bots we have on the platform to kind of have this kind of propaganda for certain topics or informations they want to get into the network. But at the moment, the version, the platform we have, we don't have a filter against errors and misinformation. So I would say misinformation or disinformation. I'm not exactly sure how you could find out errors. I think this is even more harder, and also only to a very related to a small topic, right? Because for every kind of topic, you would have to make your own error finding machine, I would guess. So if you just state the numbers of cases wrong, but actually just by a few amount, right? I mean, it's pretty hard to find these errors. Yeah, but against misinformation, certainly there are methods you can use. It's just not there at the moment. And